I do not believe in insurance companies. I'm absolutely convinced there's nothing on earth more unethical and more unlawful than an insurance company except a pharmaceutical manufacturer. Okay, and so I'm all for getting rid of insurance companies. I never understood why we pay 30% of our premium to an insurance company to tell us we can't have care. I shouldn't take 30% of the money to find that out. The first time you take one capsule of an antibiotic, you kill gut flora that I can never fix again, and the Candida will take up the space. What you do not want to do, unless you're suicidal, you do not want to start on SSRIs. Okay? These drugs lower testosterone, they're endocrine disruptors, they cause osteoporosis, they're addicting. Their doctor puts you on them, doubles them again, and then you go, I don't think I want to take these, and you stop them, and you go, oh my God, I feel terrible, I must have needed them. No, you're in withdrawal.
As a responsible person with growing concerns for your privacy and personal liberty, you want to know where we're headed and what you can do about it. We ask the experts what you need to do to take prudent and responsible action to safeguard your family's wealth and well-being, and what basic first steps will help you to be aware and prepared. ReluctantPreppers.com.
Welcome back to HealingYourself.life. We have our off-grid MD, Jane Nielsen, MD, is here with us again to talk to us about a compendium of ways that we can treat ordinary illnesses that come up and take better care of ourselves and really establish an effective relationship with our family doctor. Dr. Nielsen, thanks for joining us here again on Healing Yourself.
Nice to be here again.
In the past, we've talked about one major topic at a time, and we're going to provide lots of links in the description so people can access those major topics in depth. But tonight, you're going to take us on a whirlwind tour of many different topics that people come to your family practice seeking for your help with, and trying to tell us what's wrong with the healthcare system in America and how we can take better care of our families. So why don't you go ahead and, first of all, tell us what's wrong with healthcare in America.
Okay. Well, the first thing that's wrong in healthcare in America was the top of the news today. Okay. And Google claims that they can replace family docs with Google. Okay. That they've got the technology. We have the technology. Okay. And I think that's pretty funny. I've got this image of, instead of seeing my ophthalmologist looking into my Ring doorbell, okay, and if you go there, the proctology gets weird, okay, right, okay.
Yeah, we're not going to show that on this channel.
No, and so, this is exactly what's happening to us, is when I left my family practice residency in 1978, in 1977, family practice was destroyed. I spent 3 years, 16 hours a day, 7 days a week, studying 27 fields of medicine. When I was chief resident, the American Board of Family Practice listened to the residents, bad thing to do to let the students be in charge of the funhouse, and they eliminated 10 fields. 10 of the 27 fields of medicine family docs have not studied since I finished my residency. So if your family doctor is less than 69 years old, he's not as well trained as I am. Okay. Then a mere 5 years later, HMOs were invented and doctors quit really working for the patient at all. And they started working for HMOs, and they were more interested in whether or not their administrator thought they ordered enough MRIs than what you needed. And we've watched the decay of medicine. And we talk all the time about the fact that this is all turning, primary care is all turning into nurse practitioners, okay? And for all of you who want to say hypocrite, go ahead. My nurse practitioner is starting January 1st, and I hope to do what these guys don't do, and that's actually look at every chart and review it before she closes the chart, so we both participate in the care when she's seeing the patients. I don't have a complaint about people who do that. Nobody's doing that. These guys have got 4 nurse practitioners, and they're in Florida on the beach. Okay. This was in the news a week ago. A Chicago hospital fired every family doc on staff and replaced them all with nurse practitioners. No notice, never told them. Came in, found their doors locked. Okay. It's starting. We're done. Every day, someone comes in and says, my family practitioner retired. And when they say the name, I always know them because they're my age. And they go, and I've been to 3 more people, and I'm not happy. I'm not feeling good about this. That's our future, okay? And so we've got lots and lots of things that are just kind of all this perfect storm, and then we go a step from that morass into the fact that we're paying $1,500 a month for health insurance that has a $10,000 deductible sometimes and doesn't work. I don't see anything as more expensive than Obamacare. I mean, gosh, almost everybody I have who has Obamacare, can't use it because they can never get to the deductible. And so, yeah, the guys that are union and stuff like that, they're pretty happy with what's going on. The people who are working for a big hospital have good insurance if they go to the big hospital. Everybody else has pretty much watched their health care fall apart, except Medicare. Medicare's great. I've had it for 3 years. I love it. I never get a bill. It's just wonderful. We should have it for everybody.
I hope you're kidding.
No, Medicare's wonderful. You'd love it. I've spent $260,000 between all the things that have happened to me in the last 3 years, and thank heavens I'm finally done with all of those surgeries, and I never got a bill. Not a bill. I went in and got my colonoscopy, and my doctor billed $1,100, and he got $109. Medicare wrote it all off. Okay? I don't know who I guess it's okay. Ring doorbell's going to do it. We're okay, right? Get my colonoscopy up my Ring doorbell. Okay? It's absolute insanity. And so what I'm going to do today is, this is 8 pages, single space, and Donegan's going to put it up on the website so that you can go and download this, because I intend it to be a product you put in your drawer with your phone book. So when you get sick, you go, before I go to the doctor, I got 1 page about how you prepare to go to the doctor, and then I've got subjects, and we're going to go through them all tonight. Not in the detail I typed them up, by the way. And that way, sometimes you might skip the visits if you just simply do some logical intervention, okay? Let's go back to talking about healthcare insurance, okay? I have been proposing to anybody who will listen to me, which is no one except my best friend, who's a Democrat, and everybody marvels that we're best friends. But, we love each other more than we care about our politics, and we've learned a lot from each other over the years. I've been to lots of Democratic regional meetings because he likes to have me go and talk to people about healthcare. And interestingly, the Democrats like my plan more than the Republicans do, which they shouldn't, because it's all free market. Okay. It would be very easy to solve healthcare in America, and unlike the 36,000 pages of Obamacare, we could actually probably do this in 2 or 3 pages. Okay? The first thing is, it's unlawful to insure the first $10,000 in healthcare. Not allowed to do it. All insurance has to start with the $10,000 deductible. Okay? Now, we're paying $1,500 a month. That's $18,000 a year. Okay? So you take that $10,000, you keep it. You still got $8,000 to buy your $10,000 and above, okay? So in actuality, I'm not planning on changing the cost of healthcare. I'm starting from wherever I am and going, I just want to redesign it, okay? Now, what I want to do is I want to give every family in America a health savings account with $10,000 in it. And they can do anything they want with it for healthcare. They can buy supplements, they can get chelation, they can get their gallbladder out, they can do anything they need to do. When the $10,000 for the family is used up, then your insurance starts, okay? There's no regulations for the first $10,000. I wouldn't probably plan to do eyeglasses and dental. I would make that a separate thing. But for healthcare, everything's up, and there's no regulations. It is completely free market. Now, what's going to happen? You go up on my website, and you look, and you'll see that I have a product on my website called Lab Vouchers. And you go to my local hospital and get a PSA, it's $269. You go up on my website, and at the same place, you can get the same lab tests done in the same laboratory for $22. Okay? So pretty much I'm about 10 cents on the dollar. Okay? You need an MRI. You can go to my local hospital, be $4,000 to $6,000. You can go to Precision Diagnostics Incorporated here in my town, and you can get a cash MRI for $325. Okay, so we're 10, maybe 6 cents on the dollar. So you get your prescription for gout for Uloric and you take it to the pharmacy and it's $700 a month. Okay? But you go, oh, I got GoodRx. Oh, and you find out it's $140 a month. You go, oh, I can go to globalpharmacyplus.com through Canada from Europe and I can get it for $13 a month. So now that means that if you take all of those issues and you take office visits, if all I have to do is say, Donegan, pay me. I don't have to fill any forms out. I don't have to chase the insurance companies. I don't need any staff to do it. I can take the cost for my insurance, my visit down probably to 60% of what it is and make more money. Maybe even 40% and make more money. Okay? And so everything in a cash economy, this is what the French did, worked really well. This is their healthcare system. They've had it now for 15 years, best in the world, everybody loves it. And so you do all of that. So now, what does my $10,000 buy? And the answer is it buys $100,000 worth of healthcare because it's a 90% reduction. Okay, if you look at Elizabeth Warren's plan, it's $53 trillion in 10 years to finance it. And they say she can only raise 2/3 of that money. So that means it's $75 trillion. Okay. So that's $7.5 trillion a year. Right now, we're spending about 2.6, if I remember correctly. So she's basically going to triple healthcare. Okay. And if you look at those kind of numbers and then you look at doing this, what percentage of all healthcare in the United States is actually office visits, drugs, MRIs, x-rays, laboratory? A lot. More, over half. Okay? I mean, we'd probably have the room to start actually having some good nursing home care. And so here's the deal. So now you got your $10,000. For the first 65 years of my life, except for 2 years, my $10,000 would have sat in there. I wouldn't have used it. I didn't need health care. Well, if you do that 3 times and you get to the point where your HSA is $25,000, all the money after that flows into either a retirement fund, different from a 401k because it's tax-free. It's your money. You already paid for it. Okay? Or flows into an education fund, whichever you want to do. So I'm taking 2 major concerns for the American consumer and going, if you try really hard to save money for your health care and get your costs down, that money's not lost to you. You're actually sitting there saving money towards your retirement, saving money to send your kids to college. Okay? And the first thing that the Democrats say is, but what are you going to do with the indigent? And I go, no problem. I'm going to give them a $10,000 voucher. I'm just going to give them their HSA. They don't have to come up with the $10,000 if they, and it could be, a sliding scale event. The, more taxes you pay, the less that you end up getting this $10,000 given to you. It's still the same result because the money's still sitting there and the person who's on Medicaid is still looking up going, I don't know if I want to go out to the ER every time I have a head cold. I want to see if I can get some of that money. Okay? And so everybody's completely bought in. Okay? Now, once you get to 10,001, I'm on Medicare for all. Okay? I'm nationalized healthcare. I do not believe in insurance companies. I'm absolutely convinced there's nothing on earth more unethical and more unlawful than an insurance company except a pharmaceutical manufacturer. Okay? And so I'm all for getting rid of insurance companies. I never understood why we pay 30% of our premium to an insurance company to tell us we can't have care. I shouldn't take 30% of the money to find that out. Okay? Medicare does it for 3.2. What are they doing? What are they doing with the other 27%? Okay? I don't get it. And so you got to remember that the day that you're now getting into other people's money instead of yours, we now have cost controls coming. This is unavoidable. The French were confronted with both these problems. One of the things that they did is they said, we won't pay, because one of the big expenses is chemotherapy. And they said, we won't pay for chemotherapy that doesn't work at least 10% of the time. And you go, oh, really? That's a low threshold. We'll do fine. It eliminated half the chemotherapy. Half the chemotherapy doesn't work 10% of the time. Okay? The second thing is you have to know that 1/2 of all the Medicare dollars in this country are spent on people who are in the last 30 days of their life. And some hospitals got him on a ventilator, keeping him alive, charging $30,000 a day. And the doctors know, the nurses know, family knows they're dead. Okay? They're just milking the machine till the machine won't stay alive. Okay? That's healthcare in America. Okay? Watch it every day. Most of those people would be just as happy to go home and have hospice, take care of them at home, and not spend that money. But the minute that you go, I want to take them home, hospital attorney shows up and goes, well, have you got all your papers right? Do you have your power of attorney? You know, the game's rigged. Okay, so we're going to have death panels. Okay, we've got to have somebody who steps in and says, well, wait a second, this is good money after bad. Okay, you have to accept that. So anyway, that's my plan for healthcare. If any U.S. senators want to call me tomorrow, I'm happy to have a day free. Okay, I'll keep my phone on. I put that on the first page if any of you would like to review it and send it to your senator. I'm sure they'll care desperately. Okay.
Or not, because there's a lot of money being made.
There's a lot of money being made.
And you didn't mention hospital administrators as well.
Do you know that in 1964, that the number of hospital administrators in America from 1964 to today has gone up 100-fold? That's a concept. And I think about that. And I think, when I was a 14-year-old orderly at my local hospital, the administrative department was the administrator and a secretary. And the secretary was also the medical staff office for all the doctors, 2 people. Oh my gosh, my local hospital's got an entire wing of the hospital now. It's multiple floors for administration. So I got a lot of rules to make. So, okay. So this next document is called Summary of Integrative Care for Common Disorders in Alphabetical Order. Okay, so I'm going to start. Let's get rid of all my papers. One of the things that I put up, Dunnigan has been taking the JPEGs and making them available to you, and this is in there. I apologize for the poor printing. I needed ink when I printed this. I found this years ago, and it's just 20 steps to a healthier life, and as a preamble to everything I'm saying, I put it in there. Okay. Allergy. In reality, allergy hasn't changed much in my 43 years in practice. It's about the same. You go see your allergist. He does skin tests on you and tells you you're allergic to ragweed and animal dander, but he can't really accurately tell you what foods you're allergic to. And so if you've got ragweed and you want to go get shots 6 times a year instead of using some guna allergy treatment like I do as a homeopathic, knock yourself out. It's about all they do, okay? Other than that, they are not addressing the thing that's happening in this country now, which is that we have so many sensitizing chemicals in foods that they're the cause of so many of our health problems, okay? Have you had problems with a food allergy in last year?
Yes.
Yeah? Have you had one this week?
Yes.
Yep, me too. There you go, okay? My entire diet rotates around food allergies, okay? Whenever I walk in a restaurant, I read a menu for the purpose of avoiding food allergies and ingredient allergies, okay? And so one of the big breakthroughs that's happened is, I did not give you this to put up because it's a patient result, okay? So I'll pull the patient result down. This is called an MRT, mediated release testing, okay? This is a new technology, and this first category up here is all food additives and common things like Motrin and Tylenol. And then it's got dairy, flavor enhancers, fruits, vegetables, grains, seafood, next page, meat, etc. And this is 181 foods. And you can see here that this person has a red bar on cow's milk and carrots and basil. And having this patient eliminate all dairy, carrots, and basil got rid of half of her symptoms. And I said, well, the other half's in the yellow bars. Okay? $210. It'll cost you more than that to go see an allergist.
How long has that test been available?
About 3 years.
This is pretty new.
Yeah, pretty new. Yeah, and there are a lot of companies doing it now. Okay? So allergies will just keep entering our conversation. But the things that I put in here when I said is that if you want to figure out allergies, the way that you figure out allergies is every time you have the allergic reaction, sit down with an index card and write down everything you ate, breathed, and touched. in the day and throw it in the family Bible. And the next time you get a reaction, do it again. Next time you get a reaction, do it again, and start studying it. Now, I'm talking about journaling at a level that you write the sesame seeds down on the bun, okay, and that you look on the bottle of a ketchup if you put ketchup on something and put all the ingredients in, okay. I had a lady who had hives about once a year all of her life, and nobody could figure them out, and they wouldn't go away for a month. Ooh. And it was awful, and it was ruining her life. And I said, I'll figure you out in 2 years. She said, what do you mean? And I said, well, you're once a year, and I need 2 index cards. And I said, anyway, it's not my job, it's your job. Go figure it out, and explain to her what you need to do. 2 years later, she showed up in my office and said, I got it. And I said, what is it? And she said, orange food dye. She said, the first time it was Jell-O, and the second time it was a popsicle. Never did it again. Journaling works. You want to figure out stuff. If you're waiting for a doctor to do it, it's one of those things. Got to figure it out yourself. Okay. Arrhythmias. You've seen the ads on TV for KardioMobile. Okay. Got one. Could do one on myself right now. The Cleveland Clinic doesn't even put in Holter monitors or event monitors now. They tell people right now they're on sale because of Black Friday, $84. Usually they're $99. Okay. This does a single lead high quality EKG for 30 seconds. It only interprets it if it's atrial fib. But the thing that's nice about it is I about once every 2 weeks in my practice have somebody who comes in and says, I have an implanted event monitor, $30,000. I've had a 24-hour Holter, $2,900. I've had 11 EKGs, $1,100, etc. But they never are on at the time that I have my event.
Yeah.
And I go, hey, go get yourself a KardioMobile. The other day, I diagnosed a 3rd-degree block and had the ambulance come to my office and haul a guy straight to the cardiologist. His heart rate was 29 in my office. And I did the thing, downloaded it, printed it, said, here, take this to the emergency room. They took him up and put a pacer on him. They had spent $150,000 on him and hadn't gotten it. I got lucky, but every 2 weeks, I'm diagnosing a major arrhythmia, okay? So if you're having palpitations, then cutting down on your coffee, not a bad idea, okay? Quick solution, okay? Arthritis. Of course, it's my field. We've covered this. When I came out of my family practice residency and went into practice, very quickly I found myself running a 7-man practice. All of the doctors were my age. We're all young bucks and young girls. And we were very busy. 150 patients a day, urgent care center, family practice center, etc. And about 40% of all the patients who walked through the door were there for either neck pain, back pain, knee pain, hip pain. And I realized that in my residency, the only thing I learned in 4 months of orthopedic training was how to hold a retractor in surgery. But never did I ever have any training in what you do. And not only that, but I can tell you 40 years later, orthopedic surgeons don't know anything about the management of anything. They're just waiting for you to need a knee replacement. And if they do anything, they give you a cortisone shot, which destroys your joint and accelerates your problem, right? Okay? So we have a very, very broken system. And I always tell people that medicine always comes in 2 parts. We've got nephrologists and urologists. We've got plastic surgeons and dermatologists. We've got neurosurgeons and neurologists. We've got general surgeons and gastroenterologists. We always have a medical. What's the other half of orthopedic surgery? It's not chiropractors. It's not physical therapy. Those aren't doctors. We missed one. Okay? And so it's not a surprise that I didn't get trained to do this.
Somebody who's a physiologist who understands the physical processes and chemical processes.
It's simpler than that. Who's doing the medical management?
Right.
We're skipping right to surgical management in orthopedics every time. Okay? And so when I realized this, my mission for my group was to go out and learn how to do what I called orthopedic medicine. I'd never heard of it. I made the word up. I thought I was being real original. Okay? And I studied with chiropractors. I went and took John Barnes myofascial release courses. I took Upledger's courses on craniosacral therapy. I worked with occupational therapists. I would go, I went to standard process meetings that the chiropractors put on. I went to podiatrist meetings. I went to gait analysis meetings. And I really, really learned a lot. But they all had just this piece. Okay? And then when I first went into integrative medicine in 1993, I found out about prolotherapy, injecting tendons with 50% dextrose and lidocaine. And I said, this can't be true. If this really worked, I'd have known about it. Well, it used to be, when I thought about it, I went, wait a second, my orthopedic surgeons, when I was an orderly, did it 1 day a week in their office. Okay? But, of course, as the orthopedic surgeons went from the lowest paid surgeons in medicine to the highest, they went, I don't want to do prolotherapy on something I can do a joint replacement on. And so it all got dropped, and they told Medicare, don't cover it anymore. Okay? And so when I first started doing prolotherapy, it was covered by Medicare. And then about 2 years in, Medicare came along and said the orthopedic surgeons asked for us to not cover it. And that was a big wake-up call for me. So I had been trained by my partner. So I said, oh, I want to go learn this from somebody. So I did my work. I went to a course, and the course was by the American Association of Orthopedic Medicine. And I still belong to it today, and I taught hormones at it, and have been involved in it for years until I got involved in Haiti. And that's where I learned platelet-rich plasma and stem cells, etc. But what we actually learned at those meetings is why the heck would anybody do anything until they start 3,000 milligrams of glucosamine? Rub shark liver oil, 1222 natural relief on your joint. Take the peptide for osteoarthritis, Arthroben. Okay? You do all of that for 6 weeks. About 40% of my patients that come into me and want me to do PRP on them, they don't need it. Another 10% just needed diagnosed with gout. I'm kind of a filter for gout because nobody checks it except me now. Okay? And so the thing you really want to remember about orthopedics is cortisone destroys everything it touches. Don't ever put cortisone in anything. And don't wait until you're bone on bone, so you have to have a knee replacement when you could have come to me 5 years earlier and had platelet-rich plasma injections once every 5 years for $600 for both your knees, and you're done. And you don't have any pain at all, and you never had surgery. Okay? Bronchitis and sinusitis. Number one cause of visits in America. I had a lady call me up, send me an email, which is what I require my patients to do for a new patient visit. And she sent me an email and said, I want to bring my husband and 4 of my children in, all for a new 1-hour new patient visit because they're all been sick for a month and they're not getting better. And I sent her back an email and I said, no, you don't. What I want you to do is bring the worst 2 in. You come in, and in those 2 hours, I'll teach you how to cure the whole family and teach you how to never have this happen again. Okay? And I have that in here. This is actually the patient's notes that I dumped in here. I cleaned them up some, but you'll notice this looks different than the other ones. And, you know, I've got iodoral, iodine tablets to thin secretions, avoid antihistamines, use colloidal silver nose spray, Sudafed LA once a day, don't get addicted to it. After a nose spray at bedtime, if your ears are plugged up, don't get addicted to it. Sinus irrigation with a nasoneb, greatest device ever invented, stops all sinusitis without surgery. Okay. But the big thing is, what we're doing wrong in America is we're either calling a virus a bacteria and giving it an antibiotic that isn't going to work, or we're doing nothing and going, oh, I got a cold, I got to wait for this to go away. No, you don't. If you go out and buy Seagate olive leaf capsules, and the minute I start to get a head cold, I take 5 capsules 5 times a day. And what I used to do is I'd take 5 capsules, and 30 minutes later I'd go, nah, I was wrong. I didn't have a cold, and I'd stop. And then when it comes,
because you felt better.
Because you felt better. And now I got a rule. Nope. They come in a bottle of 3 days. If I start 5, I finish the bottle, and all colds stop immediately. Remember that all viral replication starts in the nose. It spreads to the pharynx and then to the trachea. It spreads from the pharynx into the eustachian tubes. And so if you take the good dark brown colloidal silver, I put the name of the company I use, Purist Colloids, in the handout, and you put it in a nose spray bottle and you spray pure colloidal silver in your nose every 4 hours the first day of a virus, it doesn't progress. And so this family of 5, Dad had terrible pneumonia. It took me 2 weeks to get him back to work. Everybody else in the family was better the next day. All I had to do was stop doing the stupid stuff and do the right stuff, and they all immediately got better. They were all wheezing. They all needed a nebulizer. They all needed a bronchodilator. Okay? And so never allow wheeze, never take antihistamines, treat viruses from day one, and we would probably eliminate 20% of all healthcare in America if we did this. And wouldn't it be nice if my olive leaf was covered under my health savings account? Okay. Cancer. Only thing I had that I really liked about this, I always tell people it's a wonderful book. Probably doesn't look like that anymore. I probably copied this about 15 years ago. Cover's probably been changed. Okay. It's by Tanya Harder Pierce. Okay. And it's very balanced. It's not out there telling you, don't go to your oncologist. It's telling you to listen to your oncologist. But it's also teaching you how to ask good questions. And it's also giving you a level of expectation of what is a good outcome and when you should maybe change what you're doing. We have a tendency, and it happens in my practice all the time. Most of my patients won't take a drink of water without calling me. They want my opinion on everything that happens in their health until they get cancer. And the minute that they get cancer, they quit completely being integrative and they go, I'm going to die, please drip all these chemicals in me. And then they get 90 days into it, they've destroyed their immune system, they've completely took all the barriers down, so the cancer is going to spread, and just got a horrendous mess, and I go, you took my opportunity to do anything away from me, okay? You needed to let me set the stage for making those things work. But in reality, yeah, you will take leukemia and multiple myeloma and lymphoma and put them in remission, okay? There are some tumors like seminomas of the testicle that just are magically cured. There are some thyroid cancers that can be completely killed with systemic radiation. But mostly, chemo is going to trade quality of life for quantity of life. You're going to live a little bit longer, but you're going to spend the whole rest of your life in your doctor's office. And you're not going to be fishing, spending time with your grandkids. That's the decision people are making. Okay? And so the message that I always want people to get is, number one is breast cancer, right? All these women coming in, of course they got breast cancer. They did a mammogram every year, they took birth control pills, they're drinking bottled water, and they're keeping their cell phone in their front pocket. I mean...
Not getting pregnant, not nursing their babies, having abortions, all these different things.
All of them. So many factors. Of course you're having breast cancer, okay? But the day that you find a lump, okay, your doctor wants to put a needle in it, okay? If he wants to put a needle in it, he's going to end up wanting to take that lump out, okay? My suggestion is tell him, I don't want a needle biopsy. You're going to go at this thing. Don't piss it off, okay? Just open it up, take it out, take lots of tissue. I am not interested in a cosmetic outcome here. When you look backwards and you've got a 2-inch scar on your breast, but you've got your breast, you're going to think that was a good trade for taking the breast off, okay? Radical lumpectomy has been proven in multiple studies to be a good move. I don't care where you're at in the body. One of the mistakes we're making in medicine is that we're not taking enough tissue at the first therapy. I'm taking care of a lady right now who had stage 3B colorectal carcinoma. And she had lymph nodes all the way up to her pancreas. And she told her surgeon, I'd rather die on the table than have you quit on me. Clean me out. And 3 years later, she doesn't appear to have any cancer. And what he wanted to do was watch and see if the lymph nodes got bigger. How is that going to go? Okay. And so my suggestion with cancer is the very first thing you do is operate aggressively. The only cures in cancer come from surgery, in my opinion. We have had a 60-year epidemic of candidiasis, thrush, or yeast, whatever you want to call it. Okay, candidiasis, Candida is what, and some people say Candida. I think both are true. And I could not possibly in this thing give you a primer in Candida. It takes forever to manage. Okay. I just want to make the point that the reason there wasn't any Candida until 1967 is because it took the invention of a broad-spectrum antibiotic, oral cortisone, and the sequential birth control pill to cause Candida. Those are your risk factors, okay? And so my life's dream is to be buried never having taken an antibiotic for anything. I'm still currently on track, okay? Never taken an antibiotic in my life. The first time you take one capsule of an antibiotic, you kill gut flora that I can never fix again. And the Candida will take up the space, okay? The second thing you need to know about Candida is it isn't about taking diflucan, it isn't about taking nystatin, it isn't about taking undensilic acid or any of those herbs that I use. Candida cannot metabolize fats or proteins. It can only metabolize carbohydrates. And the management of Candida is eat 0 carbs. And if you don't understand what that is, then you need to do some serious research. Do 0 carbs and the Candida goes into control. Now this Candida is starving to death, okay? Now you hit it with nystatin. Now you hit it with, 722 and all of those products that we have that naturopaths and gut mycologists are so good at. My new nurse practitioners spent her entire career just doing gut mycology. There are people who are really good at it. Not my skill, okay? Cholesterol and heart disease, okay? We've done an entire hour on this subject.
Save your heart, save your money.
Cholesterol and heart disease, okay? We've done an entire hour on this subject.
Save your heart, save your money.
Yep, and there's a lot out there, and 10 years ago people were pretty sophisticated readers if they'd figured out that statins aren't a very good idea very often. There are situations where people need a statin. It's not very common. Cholesterol is not a major risk factor for heart disease. Homocysteine is, insulin is. Who gets heart attacks the fastest in the United States? Diabetics. Why? Because heart disease is caused by insulin. They're injecting it into themselves. Until you're dying from diabetes, the insulin's just making you fatter and fatter. Okay, driving your triglycerides higher and higher, disordering everything. But what it's really doing is causing arterial inflammation. Okay, the cause of coronary artery disease is genetics and insulin levels. Okay, you don't eat carbs, South Beach diet, developed by a cardiologist. Okay, you don't get heart disease. The second thing that we're doing wrong is that we keep looking for the next best thing to fix our heart. And we've already known the next best thing since 1978 or 79, when the Harvard nurse study proved that 100 units of natural mixed tocopherols reduced your risk of heart disease 44%, stroke 29%, and cancer. Okay, that was 100 units. I'm taking 800. Okay, add to that another 16%. For a baby aspirin, they keep telling you baby aspirin doesn't work. If you took all the patients and all the studies that have ever been done that say that baby aspirin doesn't work, it wouldn't be a tenth of the people who were in the original study that's still going on that proved that baby aspirin did work. And now they're going, well, it works, but it could make you bleed. Good, well, I'm going to take it till I bleed. Yeah, I've got, mouthful of fillings took me years to get out, and the whole time they were up, the primary cause of high cholesterol, if you've got fillings in your head, is your fillings until you get all the mercury out of your system. Okay? First time I went through and did 6 crowns and took the 6 biggest fillings out of my head, my cholesterol dropped by 50% in 4 weeks. Nothing would ever make it go down. And if you take a statin and your cholesterol is up because it's binding mercury, you're going to liberate the mercury into your brain and get MS. So, Fix your vitamin D, vitamin E, aspirin, stay in shape, don't be fat, don't inject insulin, keep carbs down. Heart disease. Dementia. Now, there's my article on aspirin cuts mortality. Got so many of those in my files, it's incredible. Dementia. This product right here is sold by Life Extensions, but not anymore. The original company bought it back because the products dropped in quality. But for years, this was sold by the company Life Extensions. And everybody believes Life Extensions is a supplement company like Allergy Research and Thorne and Douglas, etc. No, it's a book by Dirk Pearson and Sandy Shaw. Okay? And I read the whole book back in the 1980s, and nobody liked this guy. Okay? All the integrative doctors all were mad because he suggested taking a couple meds, and all of the traditional doctors were all mad at him because he suggested vitamins. You talk about a plan for failure. About 10 years ago.
Get everybody ticked off.
Yeah, he did. And I read the book. And about 10 years ago, I was sitting at a medical meeting for the American College for Advancement in Medicine. And, you know, when you sit in one of these meetings, you're going to be out for 3 days. You tend to sit in the same place. So you know you might as well get used to the guys beside you, right? So I'm sitting there the first, Thursday morning, first day of the conference, and I stick my hand out and say, hey, Jay Nielsen, family doc. And he says, Dirk Pearson. And I went, the Dirk Pearson? He said, the Jay Nielsen? Yeah, I'm the Jay Nielsen. And I said, I read your book? He said, you're the one. And I said, my dad figured out what you said on his own. My father figured out. We've had a diagnosis. Radiologists still make it when they do an MRI. But if you go to a neurologist, they go, no, it doesn't exist. Okay? And I'll be sure and tell the 50 or 80 people in my practice who are all perfectly well because I'm treating them for the diagnosis that neurologists say don't exist. It's called small vessel disease. As we get older and we get a little calcification of our arteries, we develop little calcified places that as the blood flow slows at the very last arterioles in our brain, they will sludge. They will get thick. It's not the same as clotting. It's not the same as a stroke. It's a dysautoregulation. It's not the same as the thing that ginkgo biloba is fixing. That's a different mechanism. That's an arteriospasm. This is a sludging of blood. And if you take Coumadin, the anticoagulant, rat poison, warfarin, okay, in a small dose, not the dose you'd take because you had deep venous thrombophlebitis and a pulmonary embolus with blood clots to your lungs, but usually less than a half of that dose. So your PT, your blood level of clotting, goes from normal, 12, up to 14 or 15, where usually we shoot for 24 if you have blood clots, okay? Now you don't have to have a lot of blood tests because you're not taking that much. These people immediately see their dementia go away if they have small vessel disease, okay? I have a lady, as a matter of fact, I'm seeing her tomorrow. She comes in about twice a year, and I'm seeing her a lot right now because they made her stop her Coumadin to have her cataracts fixed, and they wouldn't let her take it for 14 days, 7 days before, 7 days after. By the time she got to the end of the 14 days, she was back to full-blown Alzheimer's, completely demented. And I had the family all ready for it. I said, this is going to be painful, okay? And then we turned around and put her back on a Coumadin, and 4 or 5 days later, she was caught up. And she said, that was like a nightmare, Dr. Nelson, to watch that all coming back and know there wasn't anything I could do about it, okay? And these people develop little unidentified bright objects, and sometimes they'll get confused with multiple sclerosis. Sometimes they'll get confused with Lyme disease. But if you keep them on Coumadin, the little unidentified bright objects, as radiologists call them, go away. Okay? Their atrophy gets better. The shrinking of their brain gets better. Interesting stuff. That was Dirk's thing. Interestingly, there were some people before Dirk who knew this because my dad knew it in the 1960s before he ever wrote the book. Okay? The second thing is, if you're out there at my age and you're starting to play the game, I think we talked about this one night as we were doing this, okay? And my wife and I are starting to stand in the mirror in the morning and go, you know, and you can't figure out names. And finally, one morning, we admitted that we were both losing our memories. So I came in, I called Emerson Ecologics, the people that I buy all of my supplements through, because they let me buy partial packs. They carry everything in the industry. I don't have to become dedicated to one company. I knew the president of the company many years ago when I was doing research, so I can call him and talk to him. And we were friends years ago. And I called him up and I said, who makes the best ginkgo? And he said, Pure, of course. Not a surprise. Okay. Good company. Okay. I said, send me 6 bottles. And so he did, and I'm supposed to be 1 twice a day. So, of course, I took 2 once a day because I'm inherently non-compliant of a second dose. Although now I'm on twice a day meds for something, so now I could do it. And the key to the second dose has got to be in front of my alarm clock. That's what works for me. And I went on this ginkgo. About 3-4 weeks later, Jan looked up one morning and she said, you're winning the game. I said, yeah, I went on ginkgo. And she said, get some for me. I said, here it is, 2 a day. She just hates taking supplements. She said, 1? I went, no, 2. Didn't even bother with the twice a day thing. And about 3-4 weeks later, we were back not playing the game. And so your first step when it's just age-related memory loss is look at ginkgo. But when you start developing all of the symptoms of dementia, remember Coumadin. But remember that we have 13 published studies in the United States that date all the way back to 1964 that have proven that people who fix their hormones after menopause and don't wait more than a year have an 85% reduction in risk of Alzheimer's. 85%. I watched Jim Dobson watch a show one night. He did a show and he had a guy on talk about Alzheimer's, and the guy said, he says, we got to find the cause of this. And this researcher said, oh, we know the cause. It's menopause. He says, who's in nursing homes? Women. He says, this is menopause. He says, you got to be kidding me. He said, no, we got lots of research to prove that. Well, that wasn't a surprise to me. I fix all hormones in all of my patients all of the time. And I've been in practice for 43 years. And in the people who do what I say, I've never seen a case of Alzheimer's. Not one case. It's completely preventable disease. That's the important point about dementia. Dental hygiene. About 10 years ago, maybe 12 years ago, I was in for my routine cleaning by my ex-dentist. And, ex-dentist, yeah. And they're doing the little probe thing. And all of my life I've been 2, 3, 1, 2, 2, 2, 3, 2, 1, right? Okay. And that's mostly because I was a cross brusher. Okay. And I'm getting 6, 7, 5, 6, 4, 5. I'm going, excuse me? She says, what has happened to your mouth, Dr. Nielsen?
That's a detachment of the gums.
Sure, all the gums are all letting go. Okay. And so they brought the dentist in, and he looked at the numbers, and he said, okay, I want you back in here on Friday, and we're going to do gum grafts. Okay? Get you out to the periodontist and do that whole thing. And I said, I'll call you. And I went home, dusted off my water pick, fired it up, blood everywhere. And started water picking morning and night, and could tell just by the way my mouth felt that it was a lot better. 4 weeks later, walk back in, do the thing. 1, 2, 2, 1, 2. She said, how did you do that, Dr. Nielsen? I said, by using the product that all dentists tell all of their clients doesn't work.
The water flosser.
Water pick. Can't beat it. You should use a water pick at least once a day, everybody. I have people all the time that come in and I go down my history and I see, gum recession, gingivitis and all that stuff. I go, using a water pick? And they're there. They might be in because they have Crohn's disease or something really serious. And they come back the next visit, And I go, so how are we doing with the inflammatory bowel disease? Oh, my gums are a lot better. All I want to talk about is their water pick, Do not believe your dentist, okay? The second thing that you want to remember is that your teeth are two arcades, that the reason your molars are really big in the back is because they're the buttress against which all your teeth push. And when you start removing teeth and losing gaps, plan on watching your teeth all start to fall out because they hold each other up. And you don't need your wisdom teeth, but you need your second molars. I had an extraction of my right lower second molar 2.5 years ago, and immediately my entire mouth stabilized because I had a chronic infection. I was fighting it. I wasn't winning, no surprise. And today I had my teeth cleaned, and I told my dentist, I said, it's time to get a peg and, a post and get that thing fixed because my TMJ is starting to come back because my mouth is shifting, okay? Try not to allow tooth loss. If you do, then try and do that work that you can get done now to keep all your teeth, whether they're, what's the old saying, be true to your teeth or they'll be false to you, okay? Diabetes. I don't really treat diabetes. I don't have any diabetics in my practice. The reason is I forbid it. I don't allow it, okay? I explain to my patients that there's no reason to have diabetes if you don't eat carbs. Banting and Best, people think Banting and Best won the Nobel Prize for inventing insulin. Ask any fifth grader. Well, not anymore because fifth graders don't know anything anymore. Ask any fifth grader my generation. Banting and Best proved that if you take the pancreas out of a dog and take all of their insulin away from them, they don't develop diabetes if you don't give them carbohydrates. That's what they won the Nobel Prize for, okay? If you don't eat carbohydrates, you don't cause insulin secretion. If you're on a bunch of meds, that's going to make your blood sugar plummet. You're going to have to start tapering off of meds quickly. And over anything that could be 4 weeks out to 6 months, I taper all of my patients off of all of their meds because they're not eating any carbohydrates and they're not diabetic anymore. I'm seeing Greg tomorrow at noon. I met Greg. He was 260 pounds and he was on 7 diabetes drugs. Today he weighs 151 pounds. Ideal body weight is about 5'8", and he doesn't have any diabetes at all. His glycohemoglobin is completely normal. Okay. There are only 2 kinds of medicines for diabetes. There are 3. There's insulin, which gives you heart disease and makes you gain weight. There are all of the oral pills that give you pancreatitis. Every diabetes drug says test for pancreatitis. I have patients come in all the time with abdominal pain on a diabetic drug, and I go, who's following your amylase and lipase? And they go, what's that? And I go, really? Read the FDA insert. And I go get it, and their amylase is 10 times normal. And I go, stop your pill, it's killing you. Okay, so you got all those drugs that cause weight gain and give you pancreatitis. And then you have metformin or glucophage, okay? And for 40 years, I told people this is the only diabetes drug that I've been able to find that doesn't cause weight gain and doesn't cause pancreatitis. Use it if you need it to control sugars. If you're not going to go to me and you're going to go to your other doctor, okay? Because I'm not going to allow you to have it. And now we found out that metformin or glucophage rips B12 out of your body, so you better be on B12 shots if you're on it. And now 2 weeks ago, they published new research that causes liver cancer. So there ain't no meds. Quit eating carbs, okay? Edema, leg swelling, okay? I was at a birthday party for my 90-year-old adopted aunt. She's really not related to me. She's not even related to my wife. She's my wife's first husband, and they're our family today, okay? You got to love the logic, okay? And she's been in and out of her doctor's office because she has leg swelling, and they've told her she has lymphedema, and she's going to a lymphedema specialist. And I sat and talked to her for 10 minutes, and she hadn't had an echocardiogram, and she hadn't had venous Dopplers, and she wasn't receiving any treatment, and nobody had a clue what was going on, and all she'd seen was a nurse practitioner who didn't even do an exam. There is a complete workup for edema, And it includes checking your thyroid. It includes knowing your heart valves aren't leaking, you aren't in congestive heart failure, that your liver isn't enlarged, that you don't have cirrhosis, that your liver enzymes aren't up, and that you need Dopplers to know that you don't have deep venous or superficial thrombophlebitis, that you're not throwing pulmonary emboli to your lungs, that you don't have varicosities. It's pretty basic stuff. Okay. Oh, and anemia. Anemia gives you like edema because blood holds fluid inside your veins, and if it's low, it's a sponge that you don't have. Okay. So I gave you that list. Okay. Make sure that you look at it. Fatigue. We don't have enough time. You could spend 8 hours talking about fatigue, one of the most difficult problems in medicine. Okay. And a lot of doctors just kind of given up. They go, yeah, I know. I have a family doctor. I really like the guy. He's a good guy. And he looks at all his patients when they come in with fatigue, and he says, I'm tired too. If you figure it out, give me a call. He's honest. He isn't going to try. Okay? And most people come in and go, fix my thyroid, doc. I'm tired. And, yeah, thyroid's a cause of fatigue. It sure is. Okay? But you'd be surprised how few people it ends up being the only reason that they're tired. One of the things that I do very early is I do a complete workup, check all the hormones, check thyroid, and I always get a B12 level and a vitamin D. And if that B12, you got to be careful. When I was in medical school, B12 was 4,000 to 8,000.
Normal range.
Normal range. That guy they found buried in the ice was 7,000 years old. He had a 77,000 level, and our normal today is 300 to 900. Somebody's wrong. Okay? If I see a B12 that's inside normal or under, isn't over 900, okay? When the patient's in the office, the first day that I see him for lab, before I do anything else, I give him a shot of 2 cc's of B12, and I go, today and tomorrow. If you feel a lot better today and tomorrow, you should not be able to feel a B12 shot. If you can feel it, you're really low. We need to work on that. And probably once every 3 or 4 days, I have somebody who comes in and says, that really helped. Did it make everything go away? No. But it was a big factor. Well, you don't want to be out there fixing your thyroid and doing all this stuff if all it needed fixed was your B12, okay? There's a reason why we're losing our B12. Lots of reasons, and it's going to be one of the last things we talk about, toxicology, okay? Can't get into that one. Emotional disorders. My wife and I are working on an entire book, and Donegan and Jack and my wife Jan and I are going to do a 3-part series coming this year. When I get caught up in January, we're going to start looking at doing this. I want to spend an entire night on anxiety. I want to spend an entire night on depression. I want to spend an entire night on all other psychiatric disorders. Okay? I want to talk about supplements, toxicity. I want you to hear all the things that my wife's really good at, talking about the simple things you can do to solve these problems. What you do not want to do, unless you're suicidal, you do not want to start on SSRIs, okay? These drugs lower testosterone, they're endocrine disruptors, they cause osteoporosis, they're addicting, their doctor puts you on them, doubles them again, and then you go, I don't think I want to take these, and you stop them, and you go, oh my God, I feel terrible, I must have needed them. No, you're in withdrawal. You must stop those drugs no more than 10% of the dose every 2 weeks. Sometimes it takes me 6 to 8 months to get people off of these drugs, okay? And in the end, the patient concludes they did not need them, okay? And you can't trust the pharmaceutical industry. Donegan will put this up. Very nice colored chart in the scan, okay? This is the new pivotal bipolar depression study, post hoc analysis of pooled data. Okay? Check this out. Apparent sadness. The top one is the patient and the bottom one is the placebo. They're both 3.9. They lied and made the bar longer.
Yeah.
They're identical. Reported sadness, 4.0, 4.0. They lied, made the bar longer. This drug does nothing. It does nothing. It doesn't move anybody by more than 3 or 4%. And the FDA put this on the stinking market. Let me do the Rush Limbaugh thing. It's incredible. These drugs are all fraudulent. They're crap. You should only be on them after you've seen people like me who go, maybe you need to do this. But you walk into a psychiatrist, you're going to get one, they're going to double it, 3rd visit, they're going to add one, double that one, and you turn around, you're 6 visits out, you're on 7 drugs, you can't remember your name. and you go, and I don't care about anything. It's called anhedonia. I don't care about anything, okay? That's what you get from taking those drugs. Yeah, you're not suicidal anymore. You're not depressed. You're not happy. You're not anything. You're addicted, okay? And the best drugs are the old drugs. The old drugs didn't have 3.9 against 3.9. They actually worked, okay? They killed you, but they worked, okay? Stay around. We'll talk about all of that in detail someday, okay? Gout. If you hurt and you've taken glucosamine 1222 Arthroban, it hasn't helped, and you've taken anti-inflammatories and Motrin so you can have a heart attack, and it hasn't helped, you need a uric acid. Do not sit around waiting for uric acid to cause a big toe, okay? It can just make all of your pain worse. 10% of all the patients who walk in my office end up having gout. Short story, okay? I also put some stuff in there about where to find the right meds cheaply, because the meds are very expensive. Headache. Number one reason for people to walk into a neurologist, probably the number 3 reason for people to walk into a family doc. Okay? I don't think there's anybody out there who knows how to work up a headache. Everybody's out there, they think headache means migraine. Okay? Yeah.
That was my next question.
Man, migraines are easy. Okay? I get a little scintillating scotoma in one eye and a little pounding that then turns into, and I get nauseated, I'm a little dizzy, and I have to lay down. I'm photophobic, I don't like bright light, and I don't like loud noises. It's a migraine. Not many people do that. Are there people who do that? Yeah, they need to be treated for migraines. We could spend an entire evening talking about how you prevent migraines by figuring out what you're allergic to. See, the first thing we talked about. Okay, food allergies. Okay, triggers, etc. Gut mycology, all kinds of things. Migraines are real complicated. Okay, but most people who have a headache have a bad neck. They got a herniated cervical disc, they got Borrelia syndrome, they got Arnold-Chiari, they've got C1, C2 dystocia, and they need to see a Gonstead chiropractor who does low-impact chiropractic. They've got sinusitis, they've got TMJ, and they need a competent dentist who does TMJ to balance their teeth. They need glasses. Actually happens sometimes. They got glaucoma. There are a lot of causes. Think about all the causes. Your doctor's not going to figure this out. You're going to have to work on each one of these things and decide, I don't have TMJ. Get a neck x-ray. See your chiropractor for a visit. See if he changes your neck. Okay? We could spend forever on headaches. I'm not going to. High blood pressure. I just am chronically angry about high blood pressure. A third of my new patients who come in my office are on 1, 2, or 3 blood pressure medicines. And the reason they're in my office is because they're dizzy and fatigued. And have some dementia, okay? And I go, what are your blood pressures at home? And they go, huh? I go, what's your home blood pressure cuff show? And I go, who is diagnosing it? And they go, well, the doctor's office. I said, really? I think we ought to have state troopers take blood pressures. Hi, I caught you doing 70 and a 25. Okay, by the way, we're doing free blood pressures today. Would you like one?
And
you'd look at that state trooper and go, are you insane? Who in their right mind would have you do my blood pressure? Well, you feel the same way about your family doc. You know that he's going to give you another pill today. He's going to do another test, going to do another thing, and he goes, must take your blood pressure.
Since you brought this topic up about a year ago, I've started noticing, I never noticed before, the situation surrounding when I'm asked to get my blood pressure. And invariably, it's never been as you described it should be, when you're at rest with your feet on the floor. And
never. It's they walk in, the nurse sits you down and go.
And they're asking you questions at the same time. And it's like, wait, don't you want to wait a minute so I can calm down before you... I just walked in here from the...
Well, I tell people, get a blood pressure cuff. And eventually, if you doesn't make sense, you got to go get a couple blood pressure cuffs and get your blood pressure cuff calibrated by your doctor, etc. But generally, blood pressure cuffs, in my experience, work pretty well if you spend more than $30 on them. The automatic ones work, but don't do this stupid stuff where you're putting it on a little digit. They need to be on a brachial artery, okay? And what you do is you just do 4 or 5 blood pressures a day. You write them all down. You put them in groups of 10. You take the highest and lowest. You draw a line through them just like the Russian and the American judge get thrown out in skating, Okay? You average the other 8, and you look at it, and that's your blood pressure. Now, you keep doing that, and when you get out to 40 and 50 blood pressures, you're going to watch your blood pressure drop about 15 points. Okay? It's called boredom. Okay? That's your blood pressure. You know what happens in my patients? I get 70 over 30, 80 over 40. Okay? And in a comment line behind it, they got dizzy. Okay? Had to lay down. Okay? And you start tapering blood pressures, and they come back in, and a year later I go, how's your blood pressure? And they say, it's fine, run 120 over 80. Sometimes I'm 140 over 90, 1 in 10 times. 140 over 90 is where we used to start treating. Family docs are being told now that they should be treating at 110 over 80. Okay? Everybody who's on the National Consortium for Hypertension Research that sets the standards for blood pressure in the United States are now pharmaceutical representatives.
They just informed me at the work screening they do at that they've lowered the range.
Yep.
Where they could, yeah, 120.
They did the same thing to cholesterol. When I was in medical school, an acceptable LDL was 190. By the time I got out of my residency, it was 170. By the time I got in practice, it was 160. Then it was 130, and now it's 110. They're not going to let you win. Okay, you can perform till the cows come home. They're not going to let you win at 80.
Last week they told me 90.
Yeah. My boys are both cardiologists. They say 85. Okay. True story. Okay. Irritable bowel syndrome. Okay. You want to have some fun with your doc. Next time he tells you you have irritable bowel syndrome, look at him with don't look with glee. That won't work. As seriously as you can and say, thank you, doctor, for figuring this out. Now all we have to do is figure out why it's irritable. They will throw you out of the room. Okay. They don't care. They're going to give you an antispasmodic and an antidepressant. Okay, that's what you get in traditional family practice. Okay, irritable bowel syndrome is a global term that I still use because I haven't figured out what somebody's got yet. It's a diagnosis of exclusion. Eventually, I'll figure out what you got, and we'll change your diagnosis. It may be candida, it may be dysbiosis where you got the wrong bacteria, it may be pancreatic insufficiency, you need digestive enzymes, it may be achlorhydria and you need gastric acid. It is not very likely that you need to be on a proton pump inhibitor and poison your stomach. Okay. If you've got irritable bowel, before you go to any doctors and start down that happy horse hockey, I want you to do 2 things. Well, 3. Quit eating GMO. Get rid of gluten. Okay. 1. Best digestive enzyme in the world. Digest Gold. Buy a bottle. Take one with every meal. 2. Order this product. If you can't find any place, it's on my website, Orthobiotic Powder. Nice thing about this product, they're all the same. All these probiotics are pretty much the same. The only thing that's different about this is it's bulk with a scoop in it. You take the scoop, get a bunch of cans like this. They don't come with a key. And you put a scoop in. You take almond milk, coconut milk. I like the texture of almond milk. Okay.
Macadamia nut milk.
Macadamia, there are lots of them. Okay. You want it to be sugar because the bacteria need sugar and water. And when you get done, a texture that you like. That's all it is. Okay. You take your little thing, shake it up. Don't leave the key in. Okay. And you set these things out on top of your counter. I do 6 of them at a time if my gut gets flared up. I learned to do this last year when I got Campylobacter from rafting on the Shenandoah. And you let them sit on the counter for 4 or 5 hours. You do that to taste. If you go too long, it starts tasting pretty nasty. Okay? And what's happening is these dead bacteria are being rehydrated and duplicating themselves a couple times. So if there's 1 billion of them in a scoop, you end up with 4 billion. Plus, instead of being 90 days old with no oxygen, they're now brand new. Okay? And then you drink one of these twice a day, morning and evening. Okay? And you take your digestive enzymes and watch your irritable bowel go away. You go, oh, I'm better. I go, which was it? Stop one, then put it back. Stop the other. Oh, I need both. Well, you got pancreatic insufficiency and dysbiosis. Or you come back and say, nope, wasn't the Digest Gold. I go, so you got dysbiosis. So you keep doing that for a month or 2, and then you try once a day. Okay? and you never stop because the antibiotics you took screwed up your gut, and this is your fix. Infection control. We could spend an hour on this. We're not going to. What I want to do is get you to change the way that you see the cause of infection and its treatment in two simple statements. One, all infection except meningitis and viruses is obstruction of something. If it's acne, it's a comedone. If it's an abscess, it's skin and it needs a knife stuck in it. If it's pneumonia, you should have been using a bronchodilator. If it's sinusitis, you should have been on an expectorant and using nasal irrigation to get the mucus out of your head. If it's a urinary tract infection, your bladder has dropped or your prostate is too large. If it's a gallbladder, you've got a stone plugging something up. If it's diverticulitis, you've got a strawberry seed or a raspberry seed in your diverticulum. Okay? Pick it. Okay? All infection is about obstruction of something. The first thing you want to ask yourself is, if I'm not going to keep doing this over and over again, what am I doing to get rid of my obstruction? Number two, the number one thing written by primary care doctors and internists in the United States today is broad-spectrum antibiotics without a culture. And then you turn around and you're in the hospital with a temp of 104 on an antibiotic, and you don't know what you have, and you're not going to find out because you already took an antibiotic. Okay? Do never, ever, ever take an antibiotic until you've collected a culture of what's infected. Period. I'll repeat that. Okay? Never, ever, ever take an antibiotic unless you've collected a culture. I'm amazed at the number of people come in and say, I have 6 urinary tract infections a year. And I go, what are your cultures showing? They go, I've never had a culture. And I do a culture and they don't have a urinary tract infection.
Is an analogy here like a crime scene? The detectives arrive. And
put the tape up.
Nobody touch anything.
Don't touch anything.
We got to get samples of what's here before we start.
Before we contaminate it and destroy the crime scene. And that's exactly what's up. Number two is, it amazes me how many people take a broad-spectrum antibiotic and give themselves candidiasis for something that they could have put a lotion on. Cellulitis. They're going to give Cleocin to their right thumb and their left big toe plus this spot on their arm. Why don't you get Cleocin lotion with a sponge top? You can put a lot more antibiotic on it. It's not going to go in your gut. It's not going to cause C. diff. Okay? And treat the problem locally. People come in, they start getting sinusitis. I give them gentamicin and itraconazole and saline in a nose spray. Neither one of those products are absorbed if you swallow them. Okay? You're only getting 1/100th of a dose. Spray it in your nose, one day it's gone. Never took an antibiotic for sinusitis. Okay? Always ask yourself when the doctor's getting ready to do something, is this possible to be treated with something topical? I'm amazed at the podiatrists who put people for 3 months on antibiotics. And they come into me and I put them on topical clindamycin and a digestive enzyme with seroflozyme, and their leg ulcer heals up in 3 days that they've been working on for 3 months. Okay? The problem was it was infected. It needed treated. Okay? Osteoporosis. It's called postmenopausal osteoporosis. Fix your hormones. The only other variable is vitamin D. We did an entire coverage of it, and I gave you the link in my article for female hormones. It's all covered. I'm not going to deal with it. Shingles. My staff is completely trained that if you call my office and say, I need to see Dr. Nielsen as a new patient or an existing patient and I have shingles, they are not allowed to give you any visit later than the end of my day. I don't care how late it is. I will see you at the end of the day.
We know how to get on your schedule.
Yeah, I'll kill you if you lie to me. And because I really like being at the office at 7:30 at night, right? The reason is, if I can get to shingles within 72 hours of the eruption, I can completely make it stop in 48 hours. You know people who've had shingles. They have it for 6 weeks, 8 weeks. It keeps getting worse for 42 days. Okay, then it starts getting better. Then they develop post-herpetic neuralgia. Their rash is gone and they're on Lyrica and narcotics for pain. None of my patients ever have any pain within 48 hours. The reason is I do 3 things always. 1, I give 4 cc's of B12. B12 is the vitamin that heals the sphingomyelin sheath on all nerves. This is the virus coming through the hole in the nerve and out to the skin. When you give B12, the virus wants to go home. It doesn't want to be trapped out. Remember, this is chickenpox from childhood coming back because your immune system stopped. By the way, do not do varicella vaccine. It causes shingles, okay? Just, if you get shingles, treat it the way I'm saying. Then I give 2 cc's of B12 every 48 hours until I'm satisfied I'm controlled. I usually have the patient give that to themselves. I get lysine, the amino acid, 4,000 milligrams. They're 1,000 milligram caps, 4,000 milligrams twice a day. It's an excellent antiviral. And I give the drug Famvir. Do not let anybody give you a cyclovir or Valtrex. It's 1/800th as effective. Okay? You got herpes? Do a cyclovir. Famvir is 1/800th as effective. This was developed for shingles. I was the lead investigator for this drug back in the 80s. Know this drug well. Okay? Take it for 7 days, 48 hours. Everything's dried up. Pain's going away. You just keep going. You keep treating as long as it's getting better. When the skin's all healed up, you start dropping therapies. Sometimes you relapse a little bit. You have to put something back. Usually not. You've gained momentum. That was your vaccination. Now you'll never get shingles again because your antibodies are back up again. Okay? Skin problems, dermatitis, dermatologist visits. Okay? I marvel at the number of people who come in and say, I've been seeing my dermatologist for 2 years. This is my 6th prescription of antifungal, cortisone. Nothing's working. And I look at it and I go, that's contact dermatitis. And they say, that's what my dermatologist said, but now he says it isn't. I go, easy. Let's do a skin biopsy. Pick up 1/10 of a cc of lidocaine, stick it underneath the skin, take a 4 millimeter circular punch biopsy, drill down until you're to fat, pick it up, snap off the fat, put it in a bottle, put 150 interrupted stitch in, put a Band-Aid on it, send it off to Pincus dermatopathologist. The best dermatopathologist in the world, doesn't charge any more than the worst. Okay? And 8 days later, I get this 2-page report that says what it is. Why am I guessing? That cost $85. Why am I guessing? You don't know what something is? Give them one try. At the second visit, I want a skin biopsy. Number 2, the most important nutrient to the skin is zinc. I have a product. You can buy this and do this at home. Okay? Darn it, got it on my hands. Called Zinc Drink. This is zinc sulfate. And if I gave you 5 cc's of this, put it in your mouth and have you swish it, you need to be turning around going, oh my God, this stuff's awful. I can't, I'm sorry I touched a cap because now I'll touch my tongue and I'll taste this stuff for days. I hate it. It's the worst tasting thing in the world. If you have a zinc deficiency, you can't taste it.
You asked me that my first visit here. You said, what do you taste? I said, nothing. You go, okay, you got serious
You get serious problems. It takes zinc to taste zinc. Taste buds are a dermatologic event, okay? But they're a taste instead of something else. So you don't have any other nutrients that you can test this way in the human body. It's called a zinc tally, okay? Most patients are positive who have dermatitis. So you go to your custom compounding pharmacist and you buy a product that's over the counter called Dermazinc. And you take this stuff and you rub it 4 times a day on a portion of your rash. And your psoriasis or your eczema or your contact dermatitis abruptly goes away in 2 days. You have a zinc deficiency. Start taking zinc. Okay? Take too much zinc, you get irritable bowel. Okay? A lot of people can't take more than 60 milligrams a day. Okay? Fix your zinc. It takes years. Like magnesium, it takes years. Sleep apnea. Okay? Universal problem. Okay? I've probably seen 2,000 or 3,000 sleep studies in my life. Do you know how many of them were normal? 2. All sleep studies are positive. Oh, there's something wrong with that test. Okay? Are sleep studies not useful? No, they're very useful. The person is waking up with a sore throat and a husky voice and facial edema and a headache and they're not sleeping well and they're waking up with a start and they can't get air. Those people are dying. They need a CPAP machine. Okay? But the vast majority of people get their CPAP machine and it won't work. So they want to sell them another one. Oh, we'll adjust it. We'll charge you for a bunch. I go, what are we doing here? Okay? You got to be kidding me. Get back here. I got it. First of all, the cause of sleep apnea is obesity. Okay, you don't see a lot of sleep apnea in skinny people. Your throat's fat. Lose weight. It'll make your diabetes go away. Second thing is, this is called the pillar procedure. This is 3 silastic tubes with a spring inside of them that you put in your soft palate. See it right there? And it lifts your soft palate up. Everybody who's bothered to go all the way to Rochester, New York and have this done, which is the nearest I can find somebody to do.
It's like a breathe right inside your mouth?
Exactly. These things are great. Don't cut the back of your throat out. Lift it. Rush Limbaugh response to that. Okay? If you're going to take a wet tube full of steam and put it in front of your mouth and nose and breathe in and out of it all night, do you think it's going to get infected? Everybody with a sleep machine has sinusitis.
Clean it.
Get a SoClean machine and get a nasoneb and get rid of your sinusitis. Okay? Testosterone. By the way, sleep apnea. Study in the American Academy of Family Practice, 1984. The risk of sleep apnea in women goes up 800% at menopause. 800%. Have you ever heard of any disease that went up 800%? It's an all-time record for me, along with milk allergies causing ear infection. That's also 800%. Okay? Fix the menopause. Come on, folks. We can figure this out. Testosterone failure. Okay? Everybody's talking about T now. Okay? Common problem. It ought to be. We're eating soy. We got GMO. We got Wi-Fi transmitters and range extenders and cell towers. And now we're going to have 5G and everybody's testosterone is going to be 6.
And
okay?
Not to mention the female hormones in the meat and in the water. All the Glade air fresheners and the Febreze and all the estrogen endocrine disruptors, etc. Okay. And the birth control pill that goes out the estrogen in our water supply.
It's in our water supply. You can tell. There are 2 things you can see in your water on gas chromatography: is Cipro and birth control pills. Those are the 2 things that show up in our water. Testosterone failure is too complicated to deal with. The point I want to make is that in the end, you can do shots. They're really erratic and they cause turn into a lot of estrogen, make a mess, but they're cheap. And you got troches and creams and gels, and they're twice a day, and they work okay. And I've done them for years on my patients, and they're fine. But there's a new testosterone replacement called Sotopel. Okay, it's a 200 milligram pellet. You put 4, 5, or 6 of them in every 6 months. Your testosterone's perfectly flat. If you're spending $60 a month on your testosterone replacement out of pocket, you're better off on Sotopel. It's cheaper and it's the best. Toxicology. We don't have the time. We are completely poisoned. Let's count the ways. Gluten, genetically modified food, stevia, NutraSweet, styrenes in our plastics, the fillings in our teeth, the fluoride in our water and our toothpaste, the aluminum in our deodorant. Okay? If you aren't worried about how toxic you are, you're really toxic. Urinary tract infections, last one. Don't ever treat one without doing a culture. And if you get 2 urinary tract infections in a year, find out why your bladder dropped. All of this is going to be up on my new website, wellnessrx.org, not com, okay? WELLNESSRX.org, okay? And any of the supplements we talked about tonight are up there. My supplements tend to be cheaper than anybody else's because I don't mark them up as much, okay? We can ship to anybody. We're trying by January 1st to be carrying the 6 best CBDs in the country. Forbes just came out with a list of the 25 best, and we had 4 of the 6. We went and got the other 2. Lots of unique products like transdermal patches. I'm now going to be carrying the best mushroom products in the world. I've known these people for years. I'm going to start taking their lion's mane, see if I can make my carpal tunnel go away. All of those products can be up there. All of them I'm trying to make affordable. One of the things you're going to see is all of these videos have their own category on the website, and right below it, I have been collecting all of the best articles for the last 6 months that have been in the news that are related to health. Sometimes not to health. Sometimes I just got to put things up there because they make me mad. And so you got all kinds of links. You can see what it's about and link on it. I've got hundreds and hundreds of links. I think it's the best library of what's going on in the news that I've seen. Okay? That's out there under resources. Okay. Go take a look at the website, and we will make this, my programmer will make this available so that you can click on it and download it as a text file. So I'm hoping, my purpose tonight was to head off some of these stupid emergency room visits and doctor's visits that once you get there, nothing's going to happen anyway. Put more detail into the article than we put into this tonight. We only had so much time. Thank you very much.
And a lot of the topics that we did talk on tonight are discussed in full-length
1-hour videos, lots of them. And I put the links in. Anytime I can think of it, I put the link in my document.
You mentioned toxicity. We have one called "It's Not Detox, We Are Being Poisoned." We did an entire hour on that.
Yep.
Female hormones, did an hour on that. Male hormones, did an hour on that. So you really want to make sure you take a look at those guys. We'll also put links to those in the email that we send you if you sign up at reluctantpreppers.com and then go down and sign up for the email list.
Well, remember too that if you put in Dr. J. Nielsen, MD, and put both the titles on, YouTube filters to me. If you put in J. Nielsen, MD, you get a lot of J. Nielsens. If you put in Dr. J. Nielsen, you get a lot of Dr. J. Nielsens. But if you put Dr. J. Nielsen, MD, filters perfectly.
Well, we've been speaking with Dr. J. Nielsen, MD, off-grid and family practice doctor, and always glad for your visits back here on healingyourself.life.
I'm looking forward to doing this stuff with Jack and Jan.
Yep.
We're going to get into some real high-tech stuff, and I think we're going to get a lot of people who are going to go, I know family members who need to watch this.
The other thing, folks, that you can do is email us at reluctantpreppers@gmail.com and let us know what topic, if we haven't covered it, you might be particularly interested in or you think would be of high interest, and we'll consider those in future episodes as well.
Absolutely.
Thanks, Dr. Nielsen, for joining us.
Thank you.
HealingYourself.life provides information for awareness, educational, and support purposes only and does not diagnose or prescribe treatment for any medical condition. Viewers are encouraged to do their own due diligence and consult with their own medical caregivers before making personal treatment decisions. They say the stock market crashed today.
Yeah, I heard that.
Sounds like people's retirement accounts and savings accounts are going to get bailed into the banks.
Yeah.
Looks like pension plans and Social Security are going to get suspended too.
I know.
Sure, I'm glad we decided to put our money into gold and silver instead.
Me too.
Get your gold and silver and support this channel at goldsilver.com/?AFF=RP.